Welcome. In this session, we will explore the language of veterinary pathology, learning the essential terminology needed to understand diseases, lesions, and tissue responses. Understanding veterinary pathology begins with mastering 5 essential terms. First up, cell. It's the smallest unit in an animal's body that can survive and function on its own. Next is tissue, which is just a group of cells working together. There are 4 main types: connective, muscle, nervous, and epithelial. Epithelial tissue is especially diverse. Think of skin cells called keratinocytes, intestinal cells called enterocytes, and liver cells called hepatocytes. Then we have organs and organ systems. These are made from cells and tissues during development, and each has a specific role in the body. Structure is all about how cells, tissues, and organs are arranged and how they work together, both in normal conditions and when there's injury or disease. Finally, function is what these cells, tissues, and organs actually do: their metabolism, biochemistry, and molecular processes that keep the body running and help it respond to problems. We should remember that pathology is the study of disease, but it is not the same as a lesion. A lesion is a structural abnormality in a tissue or organ. Often, you might hear someone say, "No pathology is observed," whether in lectures, clinical rounds, or journal articles. The more accurate way to say this is, "No lesion is observed." It's also important to note that all lesions are inherently pathologic, so referring to a pathologic lesion is redundant at best. Using precise terminology helps avoid confusion and improves clarity when discussing disease in veterinary pathology. Even though pathology shares vocabulary with other veterinary courses, some words can have different meanings depending on the context. Precision is key when discussing pathology. For example, the term malacia, which literally means softening, has different implications depending on the tissue. In bones, it indicates a lack of mineralization, but in the brain, it refers to liquefactive necrosis. Another crucial term is necrosis. This refers to the death of cells within tissues and organs, not the death of the animal itself. Necrosis involves the structural changes that occur after cell death and forms the basis for recognizing and interpreting many lesions in veterinary pathology. Understanding these terms in context is essential for accurate interpretation and communication in the field. In veterinary pathology, we study various responses to injury, including inflammatory, non-inflammatory, degenerative, and proliferative changes in tissues and organs. In veterinary pathology, many terms are based on Greek suffixes, which help describe the type of disorder or tissue response. Itis indicates inflammatory disorders, like nephritis. Opathy refers to non-inflammatory disorders, such as neuropathy. Osis, non-inflammatory conditions, example, hepatosis, degenerative conditions, example, steatosis, ongoing processes, example, cirrhosis, or existing states, example, calcinosis, in tissues or organs. Omegaly means enlargement, as in splenomegaly. Ectasis is used for dilation, like bronchiectasis. Penia indicates a deficiency, for instance, neutropenia. Plasia refers to cellular growth or multiplication, such as aplasia, hypoplasia. Hyperplasia trophy relates to development or nourishment, like hypertrophy. Genesis means origin or production, for example, agenesis, osteogenesis, carcinogenesis. Pathogenesis cellae indicates a distended sac, like meningocele. Hematoceloma describes a mass or tumor, such as osteoma. Learning these suffixes helps you quickly understand and describe diseases in tissues and organs.